Hello, my name is Amanda Moore, and I'm the founder of Appendicure. My husband was diagnosed with goblet back in 2024 and started Appendicure to educate, advocate, and promote new research as it relates to appendiceal cancer. I'm here with Jeremy Kitzhaber, who is from Idaho, and he's a bit of a legend, a living legend, I should say, as he was the very first patient to to be prescribed a CDK4/6 inhibitor. So I'm really honored to have Jeremy here. And I guess, Jeremy, would you like to introduce yourself quickly?
So my name is Jeremy Kitzhaber. I've been, uh, I was in the Air Force for 22 years. That's where I got some toxic exposures and stuff. And and then shortly after I retired, I was diagnosed with the PMP cancer. And I've been battling it now for 12 and a half years.
Well,
And
so if you would start off, kind of tell me about your 22 years in the Air Force. What job did you actually do? What did your day to day look like?
I started off as a civil engineer, water and wastewater treatment and plumbing. I met my wife very early into that. We were married probably about a little over a year after I joined the Air Force. It wasn't too long. And then buried her in 1991. I joined in 1990. Um, so I did plumbing. I got transferred to, we were in Colorado Springs, then I went to England, then went to the Azores Islands. Um, our boys were born in 97 and 2000, and now they're 29 and, well, almost 25. And then I retired then we got stationed back in the stateside, and I became a first sergeant at McConnell Air Force Base, where I finished out my career of 22 years. And then when I retired, we decided to move back to Idaho, where I spent like from sixth grade to ninth grade, and I got a lot of family that lives here.
So you were diagnosed right after you retired, right?
Yes,
Yeah, that
I
sounds
was.
interesting. Right after we sold our business, my husband was diagnosed. We became empty nesters and sold the business, bought a camper, and why does it happen like that?
Yeah,
um,
got all the plans, and then yeah, it didn't go my way either. So
so you mentioned just a minute ago you handled radioactive hazardous materials. Like what kind of things were you handling, and
um,
what were you told anything about it at the time?
no, I was put on a disaster preparedness support team, and then we had radiation samples, and they were like on little pin sticks or whatever, but they were detectable from a certain distance. And I was the junior on the team, and I was told to go hide them um, for drills and stuff. We did that once a month, and they were in like lead boxes, but they would hand them to me and just put them in my pocket of my front uniform, and then I would drive out to wherever we were going to do our drills and then hide them. And I was told that was perfectly safe. I even remember the tech sergeant telling me, just don't lick them, is what he would tell me on the samples. And I was like, well, why would I do that anyway?
Right.
And then later I found out that they were class one and class two carcinogens, and I shouldn't have been handling them the way I handled them. And
And so no
um,
one ever told you that at the time.
no, I guess either they were probably put on the team too. They didn't know any better. They were just, the military has had a bad habit of, in my case anyway, of making you an instructor without teaching you how to be an instructor. It'd be like you could complete a course, and then they're like, now you're going to teach it. So you just have to figure out how to teach it. And they did that to me a couple of times, so they might have done that to him as well.
Right. Yeah, that makes sense. And so again, they put it in your pocket, so you weren't given any
Yeah.
kind of
And then,
real protection, I guess.
yeah, I should have been in, I shouldn't have been handling it the way they made me handle it.
Looking back, I mean, was there like a moment that you thought, I wonder if I should be doing this?
No, I was like looking back, it's like after reading the data on this stuff, sure, but at the time, I was just thinking what I was being told was correct.
Yeah, and there wasn't really data that you could access back then.
Yeah, the OSHA standards were just kind of coming out in the 90s. So I was like just going, I had gotten out of the VA. I was waiting to see when my VA disability rating would, or sorry, I got out of the military and was waiting to see when my disability rating would be finalized. And once it was finalized, then I could start going to the VA for my medical care. And so I went to the VA for medical care. And there was just a couple issues, and they did a bladder scan. And because of the bladder scan, they noticed something. And because I was just having a little bit of trouble, like going, like completely voiding my bladder. And they they noticed a tumor or something, an anomaly, but it wasn't blocking, it wasn't causing my bladder issue. That was something that was just it could have been a routine fix, but that's when they noticed it. So it's kind of like you have something else in you. And so then they put me in a CT machine and after the ultrasound, and then that's when they noticed something even looked like more of a burst appendix with mucus in. And that's all of a sudden the tech in the CT tech
Hmm.
said, "Wait right there, I'll be right back." And I got left laying in the CT machine, and I was like, "Well, that can't be good." And then they sent me up to the ER, and they're like, "Well, you don't have a fever or nothing." So they kind of just went from there. And since they saw that um, the mass, especially on the CT machine, they said they saw a lot of them. I went in for a biopsy, and then the one doctor had like 25 years experience as a general surgeon, went in and did the biopsy and had never seen anything like that. Pulled the other general surgeon in who also had about 25 years experience, and between the 50 years they had never seen anything like that. So they didn't even know it was cancer or not because they'd never seen it before. The pathology team took 5 tries to figure out what it actually was. So they're like, you have some type of colon cancer, you have PMP, wait, no, you have this type of cancer, oh wait, you have PMP. And then finally it was like, okay, you have PMP cancer. And there was nobody in the VA whatsoever that dealt with that in the entire country at the time.
Right. Yeah.
So
So,
I had to get
so
a
you
doctor
you
outside.
had not heard of appendix cancer, and your doctors had not heard of appendix cancer. It sounds
Correct.
correct. Yeah. Um, what was the first thing you were told to expect?
Um, that I would need to come in as soon as possible for chemotherapy treatment. And and then, but one of my doctors started seeking out a specialist for me, and so did some of my family. And they found a specialist that actually knew more about it. And so they didn't, I and um, went and saw him. That was Dr. Logy in Omaha. And he took my TRICARE insurance, my military insurance. So it was important because the surgery was going to be very expensive.
Right.
And that was the only one at the time we could find that took the insurance. So I went out and saw him. He looked at it and said that he would have to do the HIPEC and the cytoreductive surgery. And that was scheduled like 3 weeks later. So I never even started chemo. But even when he stripped all the cancer out, he said there was a little piece near like my diaphragm where the heart was beating that he couldn't get to because it just kept moving. And so I would need to do chemo, and like 3 of my lymph nodes were also positive. So I came back, and I was so weak after I know there's a lot of people that have had the CRC and HIPEC, and 5, 6 weeks they were wanting me to start chemo at 6 weeks, and at 5 weeks I still couldn't walk more than like 15 or 20 feet, and without losing my breath altogether. And so they were like, if you can't walk from your car to the cancer ward, then you're not strong enough to handle chemo. So I had to wait like another week or two. But um, and then I didn't do well with chemo. I was supposed to do 12 rounds of chemo, and I didn't. My body didn't react to it well, and so they took me off of it, and I went on watch and wait, and the cancer came back within like 10 months. It was back at almost what it was prior to the surgery. So it was pretty rapid. And
So,
then yeah.
well, let me just back up for just a second because when you saw the doctor in Omaha, I was like, did he do some genetic testing?
No, he didn't. Um, I didn't get the genetic testing until I went to the other specialist.
Okay. Right.
So when I went back to him when the cancer came back, and he's like, he told me to try another chemo, so I did. And then I went back to him again, and he said, "There's nothing really I can do for you because your cancer came back so fast." I was like, "Can't you do another surgery?" He's like, "By the time you recover from it, you're going to have the cancer back again." So he just kind of sent me home to do my thing. And that's when I reached out for a couple other opinions on my own. And I found Dr. Lowy down in um, San Diego through a friend who she also had appendix cancer.
Oh, wow.
And, but at the time, his facility was listed as somebody who took like um, the VA care insurance, but he wasn't a provider that was listed. So I paid out of pocket and went down there for um, the first meetup with him, because I had already had my first opinion through the local doctor here. I had my second opinion through the oncologist in Omaha. So I wasn't going to get covered. So Medicare covered the actual appointment, but the rest of it was like out of my pocket to get down there and do everything. And uh, but I said, "I don't expect to be cured. I just want someone to help." So he said he would do everything he could to help me. He did um, just like the debulking surgery, because he couldn't, there was so much scar tissue. He couldn't do a HIPEC again. But that's when he did the circulating tumor DNA test. And that's when it showed Ibrance could have a positive effect on slowing down my cancer. And I was, I guess, the first one that ever popped up on that test for it. So going completely off label and all that, I was able to get it approved through my insurance because I had already tried like everything else. And my insurance approved it right away, which I wasn't expecting.
Was
But
that like was it the compassionate approval?
no, it
No.
was that we were going to go that route, but we didn't have to. We had the paperwork kind of ready. But my insurance came back saying, "Well, you've already done like three different kinds of chemotherapy. You've already done the surgery with the high pack, and none of that was working. And then this says it could work, so they approved it." And I started it like a month later.
Would it surprise you to know that people today with appendix cancer 12 years later, or however many years later, are still not being approved for this drug?
No, it doesn't surprise me because I keep seeing that in like our group and just other folks I know with other diseases and stuff. And you see it on the news all the time where the insurance are always saying that's like an experimental therapy or whatever they can use to get out of paying the the fees. I mean, the medicine's expensive. Everybody knows it's an expensive drug. And so it doesn't surprise me. It's really horrible for patients because we want something to try. Even
Yeah.
if it's not going to cure us, it's like, can we get another 4 years if we take this drug,
Right.
or something better? Can we get anything? And for that, um,
For a patient
it's
who's just been
for yeah,
delivered what you were delivered, that's a very fair
yeah.
question.
And so to me, like, it kind of doesn't matter what age you are. Cancer is just hearing about it. But at the time my kids were still in high school. I wanted to see them graduate. I wanted to see them go through college. And I, without this drug, I wouldn't have got that. And so I'm still here because Dr. Lowy found the drug for me. And I've been on it. It's almost 10 years now. I've been on it and I'm still on it.
I didn't
So
know that they did ctDNA tests that long ago. I thought it was newer than that.
it might have been a new thing. I remember signing something saying like, do I consent to this like experimental thing to do this stuff with my blood? And I was like, absolutely. If it'll help me or anyone else, go for it. But I'd ask him, I was like, is it going to cost me any money if I do it? I think they said the most it'd be was like $100 out of pocket. My insurance would cover the rest. So I was like, I'm all for that at the time. But I'd always ask those questions. Well, how much is it going to cover through my insurance? Because a lot, even those tests are like $4,000 or $5,000 or something like
Yeah,
that.
yeah. Yeah, so Blue Cross Blue Shield, which is who we have, just recently started paying for Signatera, which
Good.
is one of those tests, and
Yeah.
that they didn't, they actually covered the price of it because Blue Cross would not cover it for, like the first 2 years that we had them. Um, I think that is changing now. Just to digress just a tiny bit, though. So ctDNA mutations, that has really started making a lot of progress. But my understanding is like mRNA is really where this is all headed, and that is, I'm learning, that is in a VCF file that Signatera holds. So I've been trying to get that VCF file of my husband's now since April. I did get an email today, believe it or not, this morning, because I sent an email yesterday too, following up, going, "Hello, where is it?" And they said that it would be 2 to 3 weeks. That the genetic counselors had my request. I had to sign a document on all the things, but that's going to be the next step, and I think that'll be challenging for patients to get that information, because as you can see, it's taken me now since April and I still don't have it, but I'm not giving up hope. So um, sorry for the digression.
Oh, no. There's,
um, so you found Dr. Lowy through a friend, who also has appendiceal cancer, and I guess the second test found that you had a mutation that Ibrance could potentially help. So, I mean, was that like
it,
unbelievable almost for you? Because
well, it was like, it's after going through chemo and seeing the side effects of Ibrance, even the worst side effects of Ibrance, I was all for trying that. I was like, this is going to be like nothing compared to the chemotherapy. Chemotherapy for me was almost like I felt like I was dying every day. I was being kept alive at best. I didn't feel like I had any life whatsoever for at least the 4 days of the infusion, the week or so trying to get a little better. And then for those 2 or 3 days before the next infusion, I started feeling okay. And that just was a horrible way for a patient to get through it. But there was always that, well, after your 12th cycle, you might be cancer free, and then I could go back to it. So I mean, it was worth the fight. But when Ibrance came, I like for me the side effects were a little bit of fatigue, and my nails started brittling a little bit more, where they crack pretty easy, and that's about it. I didn't.
yeah, I've heard it's a really low impact drug to
Yeah,
try.
and it actually, the mutation that they were tracking, it made that disappear like that. But I have a few other things that is making my cancer grow. So my cancer was still growing, but very, very slowly, not like a tenth the speed of what it was under the chemotherapy. And so I was getting way more benefit with so many less side effects. And um,
It was like a miracle, right?
yeah, it was. I was not expecting to reach 50, let alone 55, because of how you start reading about how long most patients survive after reoccurrence, because you're not supposed to read that kind of stuff on the internet, but you do, because you got the disease or something, or I got the disease. So I
Yeah.
saw something like 80% of patients are gone after 5 years, but after a reoccurrence. And that's old data, of course. That's data from
Oh
what I was
yeah.
reading back in 2016. But so we're 10 years beyond that kind of stuff with the new treatments and all that now. So it's not the
David was
same.
first.
But at that time, what was available to us PMP patients was just those treatments prior to like the Ibrance.
Yeah.
And there was very few of the other things that were also kind of experimental that were working for anybody. And I won't name all those drugs, but there's very little out there that like helps us. And now that this Ibrance came out, and it doesn't help all PMP patients, you got to have like that one mutation that it'll slow down.
Right.
But for those of us that have that mutation, and if that's causing 90% of our cancer growth, and you can wipe that 90% out, then your cancer is growing at a 10% rate or something instead of a 100% rate.
And that buys you
But
lots of good years.
Yeah, and I've gotten up until last year, life was pretty good for being a stage 4 cancer patient comparing to uh, like where I'm at now. Where I'm at now is a worse situation, but I'm still here. So,
Well,
and,
that was going to be my next question. So where do things stand now, and like what's
um,
next? Do you?
so you can only have so many majorly invasive surgeries in your abdomen before you just can't anymore. And I had already had the initial surgery. I had the first debulking. I had a mass that, or I had my sorry, I had I mean, my intestines had like quit working for a couple segments, like a foot here and a foot there. So I had to have a colon resection on the third surgery, and then that worked. It opened me up for about another uh, 20 months or so, and then I ended up with another mass right below my stomach last year, and um, it was doing like a 90-95% blockage of my intestines. So I was vomiting a lot. It was hurting. It was very painful. So um, went down to see Dr. Lowy again, and he said he would try to bypass it, and he did. He bypassed it, but my intestines were so bad that he said it was like tissue paper in a couple of spots, and I had a two perforations happen when he was trying to separate my intestines. And I knew that could happen. I was just hoping it would. And then, so now I still have it. I was like 40, almost 40 days in the hospital and then finally got out, but I can no longer eat for nutrition. So I have a permanent PIC line and I get TPN. And I know a lot of people that have been in this group long enough know that TPN is a liquid nutrition that we get when we can't eat. Um, but so for 12 hours every night for the last 11 months, I have been getting TPN, and that gives me my calories. I can still drink, I can still eat like crackers and pureed foods and stuff, but it just comes out. But I have a stomach drain, and I won't show it to everybody, but it's sticks. I get a drain sticking out of my stomach, but then my intestines also, because of the perforation, had worked its way out the incision, and now I have two pieces of my intestine sticking out, and they can't cut me open to put it back in because it would cause more harm than good. And so I got two pieces of intestine with a hole in each one that drains externally. And I have like a wound bag to collect that fluid in. And every couple hours, I got to drain that out. And then same thing with my stomach. I either open a drain and drag it around with a big bag, or I just close it up and every hour to 3 hours, I drain my stomach because the bowels are so closed off that it, even the bile that my body produces, it can't make it through it. I would throw up. And I do every once in a while still. But most of the time I can control it with the drains and whatnot.
Is there research that are people talking about things that they can do for people in your situation? Try any kind of trials.
Not that I know of. I don't to improve my situation. The only thing I've ever heard of is like a complete peritoneal transplant, and I only know one person that did it personally. I met him on Facebook. He was out of England, and he lived a few years after having his, but it never really got him, from what I saw anyway. I could be wrong, but never got him back to like his old self. But he was still like he was able to go for walks and hang out with his family and enjoy a lot of things in life. And then, but and he passed away a few years after the surgery. But I heard the surgeon had moved somewhere to the United States. But I'm not even sure that that surgery is like being offered because my lungs. I ended up after this last surgery. I ended up with several blood clots in my lungs, so I had the embolism. I was in the ICU for a while, and I still get winded really easy. So I don't know if I would be able to handle even a surgery like that if I was even allowed to have it. So, but other than that, I don't know of anything that can help me beyond what I'm already being given with the TPN and the drains and all that. But
Well,
almost, like I said,
that's
it's
something I'll
almost
be
been a
adding.
year. So,
It's something that I'll be adding to my Google search alerts. I get them daily, and I mean, I spend the first usually 45 minutes pilfering through all of them. So, So, clearly you're living proof that this drug works, Ibrance
Yeah,
and others like it. So,
there,
so the
there
fact
is a
that,
case. There's a case study out there with one patient. It says a patient age 48, blah blah blah. That's me.
yes,
So, um, I know that's like they're not allowed to give out the patient's name or anything, but yeah, that is me. And then I know like then after that, after all my stuff was kind of confirmed for a couple of years, then there's a 16 patient study, and there's another. I don't know any of those patients, but I know I've read that study too, and like 15 of the 16 highly benefited from it, and three or four is actually like saw a reduction in their
yeah,
cancer versus just like where mine slowed it. But tell
yeah.
you anything to help put the brakes on this and slow it down for a patient is
Well,
it's a wonderful thing.
that's what Connie Zickler told me last week or week before last. I did this same kind of conversation with her, and I know another person personally they've both been, Connie and Amy have both been on it for a year. And, Connie's like, I can take walks, I can go do
Yeah,
things. And, she's like, I couldn't
I
before.
went. I've been to. Well, I can't do it anymore, so I can't go scuba diving anymore. I can't get in dirty water anymore because of all my openings and because of this PICC line.
Yeah.
But up until my surgery in August, in April of 2025, and there's a whole 10 years of a couple of surgeries in between all that, but all that and being on this Ibrance drug, I was out snorkeling in St. Thomas in April of 2025. I went to with my wife and kids and a friend and my parents at different times to Hawaii, like four times, where we went scuba diving and snorkeling and going up to the canyons. And um, I went gold dredging several times in creeks up here in Idaho, where I put on scuba gear and vacuum up the stuff. And I've been on hunting trips and camping trips and fishing trips. And we're still trying to do camping trips, but uh, it's a lot of that went away. But I got 10 years of that or 9 years of that
Because of the
from the time I
stress.
started on Ibrance until I was beyond where now I can't get in dirty water anymore. But I mean, that's all wonderful memories though.
Do you do you know of people? Have you, in your interactions and the different advocacy groups, do you know of people who have been told no for Ibrance?
I've had some people message me and ask me some questions, but like if they were rejected, and then I give them some information, but I really don't have like information on how to get approved.
Yeah,
But
that was going to be my
I,
next
w-
question.
I wish I had that. I mean, I
Like,
can
what
tell
do
you
you,
if you're in the military or you retired out of the military and you get care at the VA, they can prescribe it. If like I said, if it meets that genetic coding or something, because they can just do that. It's like, well, that drug works for you. Here you go. They don't. It's not as big a loophole as it is on the uh, insurance worlds or something
but
because
then I
they're all self.
wonder,
It's a contained thing. Everything's there. So
but then you have to wonder, like, what is it going to take to change this for the rest of the population that's not in the VA, like a label change, a coverage rule, a law, like what is the
I don't
lever
know.
that
It
needs to
would
be
it
struck?
would be nice to have um, like the patients who are on it. Of course, names don't need to be out there, but how many patients? Like if there could be like a system at hospitals that could talk to other hospitals or could pull up a drug Ibrance if you typed in Ibrance and typed in appendix cancer or PMP cancer or whatever. And if there were 150 patients out there, how many of them are benefiting from it? There's no way. I know that the computers don't talk to the other computers, and they have some of it that do that, but um, I don't. I know a few patients that are on it because they messaged me. I couldn't name them by names, but they just most of them asked me what like my side effects were and how did I feel after taking it because they're about to start it. And I tell them, I've been on it almost 10 years. These are my side effects. I'm pretty happy with what it did for me. And here's what it did for me. And then they say thank you. And then sometimes I get a message a year later saying I'm doing well on it. And I think only one person said it didn't work for them. That, but
So, have you met other veterans with appendix cancer?
um, I haven't met them face to face, but I have met online. There's still one that I know that's surviving. Um, one that passed away fairly quickly after getting it, and then one guy I actually met him. Actually, so I scratched that. I was driving through Colorado Springs, and that's where he lived, and we met for lunch. And then he passed away about a year after that. Uh, but out of and they had all been kind of deployed to places I had been, so we start wondering, well, was that any kind of contributor too? And uh,
So I
but
live
I
in Oak Island, North Carolina, and it's really close to Fort Bragg. And I know that there's an appendiceal lawsuit about the water at Fort Bragg, and also there's one kind of pending with Agent Orange. To me, that says there must be many of you out there, many of you vets out there, right?
yeah, there's all kinds of I think the in the veteran world the cancer is at a much higher rate than non-veterans, so we get exposed to a lot more stuff. But some of my veteran friends, they're still perfectly healthy, never had an issue. Um,
Do you know about the PACT Act?
yeah,
Yeah, so do you know where it kind of fits or falls into that I
uh,
guess toxic
well,
exposure?
appendix cancer is not listed under the PACT Act,
Okay.
but mine actually, I got mine service connected prior to the PACT Act passing, so I didn't have to use the PACT Act to try to get care. But with it being such a rare cancer, it usually never makes the list anywhere as far as like a cause. It's usually the cancers that are, where
Do you think it's
where a hundred
hard?
thousand people a year get this type of cancer, whereas in appendix cancer is like 700 people a year get this type of cancer. So that's what I'm saying.
Well, it's
The
more
can
than that now,
now,
and
well, now they're finding it. Yeah, now they're finding it better. But
yeah, and it was also classified as colon cancer. So the theory, and my theory, is that veterans and private citizens alike, I mean, are their data didn't count towards appendiceal because it was classified as colon. Um,
and some people don't even know how to treat it, but they try and they end up hurting the patients as well.
oh yeah,
So,
yeah,
and
yeah.
that's happened to one of the veterans I knew.
So do you think, like, so with the PACT Act, like, do you think that that's something that people should fight for to include appendiceal? Is that
Well, it wouldn't hurt to include it. They just can't figure out exactly what causes it, but they can't figure out what causes a lot of cancer. So
Do you
it
think
is,
that the VA should be doing anything for rare cancer patients that it's not?
I don't know what they're doing for rare cancer patients, so I'm not sure what's going on, but I don't know if there's always a piece of legislation or something that is driving some more veteran improved care. But I don't know, like I said, I don't know what's going on with like rare cancer research or anything like that through the VA.
So
I know there's some government plans, but
I guess the question that really I should have asked you is, do you think that because of your advocacy, that's why you got this drug first before anyone, and maybe if other people kind of knew how to do that, they could as well, and maybe they just don't know.
well, I don't know if it led to me being the first. Like when my doctor in Omaha kind of gave up on me because he didn't think there was anything else he could do. I went looking. I wasn't gonna just take it, and I was like, I got shut down by some big names in the appendix cancer world. I sent my records, and I won't name those doctors just to keep them off the thing, um, but I sent East Coast, Texas, California, and like my records and stuff. And Dr. Lowy was the only one who said he would try to help. The other ones were like, your cancer's too far along. I don't want to, I can't help you. And I, that led me to believe that some doctors, they want to cure you. They don't want to work on you if they don't think they can cure you. I don't know. That was just how it felt like to me. Cause I,
Right.
I just, I just wanted somebody to try. And if it didn't work, so be it. But I did. And that's what got me down there. And then, like I said, I went down there myself and paid my way down and all that and
Yeah.
got my third opinion. But what was cool was I was sitting there with Dr. Lowy at the tail end of that meeting, and I said, "Hey, Dr. Lowy, the your hospital takes the veteran care plan, but you're not a veteran. Like you're not a doctor who's like linked to that. And he looked at his nurse. He goes, well, how long would that take for me to get linked to something like that? She goes, about 10 minutes. He goes, make it happen. And so by the time I left there, he was a veteran approved doctor. And then when I got home, I went and said, I want to transfer from one veteran approved doctor to another veteran approved doctor. And it was like that. And then I was covered through Dr. Lowy through the VA.
Oh, I bet
So that
Dr.
was,
Lowy is really frustrated that he can't get this approved easier for patients.
is he, I don't know if how much he's struggling with getting patients to have their insurance
Well,
cover the Ibrance or
I know
something.
that he knows it's a
So,
problem, and it may not
yeah.
be his patients, but I know he knows it's a problem, which is why I added all of the molecular pieces to my registry, because I wanted to be able to very clearly show who's using it and what their results have been. And he kind of requested that, that capability from the registry, and so that makes me think, like, even if it's not a problem with his patients, he knows it's a problem in general. um,
Yeah.
so like if rare cancer, like if the VA, or any organization, and I think you might have said it earlier about computers talking to one another, if they could do anything for rare cancers like ours, what do you think they should do first?
Well, I think that the doctors who are at the VA hospitals should have access to one, especially when a pathology comes. It's like, well, how is this treated? Where can I send people? Um, from my understanding now, the VA in San Diego does have a doctor there who is an appendix cancer surgeon. And so at least a patient could go there if the VAs don't want to send them other places. Um, but I don't know I wish I knew what they could do. But
Yeah.
but like I said, I don't know what they're up to. It's beyond my scope of what I'm able to get information for.
Yeah. Yeah. um I want to ask these questions, but I know they're just bigger, like much bigger conversations. The DoD research money. So just kind of, DoD's medical research program got 1.27 billion this year. The cancer piece of it got about 165 million. Congress writes the list, which cancers are eligible. Every year, the report language is attached to appropriations bill. Appendix cancer is not on that list. So, how report language works because you were in the military. So walk me through how you think a cancer might get added to that list, if you have any thoughts on that.
I think they would have to go through like how many veterans in the past have had it,
Hmm.
and that can be found
Yeah.
because the VA computers all, I believe, are capable of getting that information. And just if they were diagnosed properly. So, as you mentioned, it's some weird type of colon cancer, is what some things might say. But I think it should be listed as something that the government needs to research and all that. It's not. I don't know. I don't know. It's not fair that folks with rare cancer don't get the same kind of research that the bigger cancers get. And I understand the money behind it. Like breast cancer affects 1 in 8 women in their lives. So
Yeah, and I understand it for like
the,
a company that needs to make
or a
money.
company that's going to make like Pfizer or Moderna or whoever, all these big companies, they don't want to spend, and this is my opinion anyway, but they wouldn't want to spend like $10 billion coming up with a drug, and let's say that would treat appendix cancer even better than it's able to do now if they can't profit from it.
Hmm.
And they would have to get their 10 billion back and then some, or whatever it would take. So and they can get that back in the stuff that's affecting 100,000 or 1 million people a year or something like that. But if it's affecting 1,000 people or 1,500 people a year, that it's got to be worth their time. And
So if you could, if you,
but if the government did it, then it doesn't have to be profitable.
right.
So I think that's where the government itself should get more involved with the rare cancers, because the other cancer funding is going to happen because it's a
Yeah,
profitable business. So
right.
I don't know. I don't know how to make them
That's a
do it
good point.
because
That's an excellent point. That is an amazing point, actually. And if you were, so let's say, let's look at the DoD and is it the JCP? Is that right?
I don't know.
Anyway, the DoD, let's just say the DoD and the VA, who, like, if there was a title that you could sit down and have a conversation with, what would that title be? And I don't know the person's name. I'm just saying, like, what would their level be? What would their title be?
Well, I think I'll say the person's name. It would We would need someone like Doug Collins, who's the head of the VA, to push it. Um,
Okay.
and that's he would say we need to do more rare cancer research, and that's where, to me, that's where it would need to come from, and then it could go from there. But I don't know where he stands on that. But taking care of veterans is there's also a certain amount of money each year that the VA gets, so they'll allocate it, but the DoD could fund it through, like,
And
I don't know.
if I were to be able to get in touch with Mr. Collins, do you think, like, is the case like the military exposure link, no approved treatments, no dedicated research or money, like which would you lead with?
I would say that there's not enough treatments and those need to be researched, like, and not just hope that someone on the outside will do it,
I
because that's kind of what we wait for on the appendix cancer stuff through the VA is we get sent to a specialist, and I don't, and they're not working like throwing some money that way or a study that way coming from them. I'm not aware of any.
So I have made two FOIA requests asking for appendiceal information from veterans. Hopefully they'll get back to me. I don't see why they won't. Um, if you had, so let's just say if you had Congress, the VA, the DoD, and the FDA all in one room, what would you say to them?
I would tell them to quit dragging their feet on the treatments that are working as experimental, because that seems to be what I see the most is they're like, well, that's still an experimental treatment, and so it's not approved. And because they have to refer us for like appendix cancer and stuff, with like there's not a whole research center within the VA. There's not several doctors that deal with it within the VA. I think surgeons need to be made aware of what a mucus in cancer looks like, so that they're not going, hey, I'll just try to get this out myself, because it takes a specialist to do it. But if they're all in the room, focus needs to go to the veterans who have the rare cancer. And sorry, my cuckoo clock's about to go off there. The But there's so much more they could do for any patient with a rare cancer besides just referring them off. But I don't know what I don't know what they could be doing, but they definitely could make it easier, because when I had mine, I kind of had to do a lot of it myself, and then come back to the care coordinators and say, this is what I found, or this is who can help me. And I had to do the work, and I'm the patient. I shouldn't have to
Yeah,
do all that advocacy to get it done. But
but you did.
one nurse told me I broke the system because I ended up getting the the Dr. Logy to Dr. Lowy switch, and they weren't expecting that anyone could do that. And I had it done just by talking to somebody, which by
Yeah.
talking to Dr. Lowy. And um,
That's what I think a lot of
so
patients don't realize is
is
they've got a lot more control. Unfortunately, fortunately or unfortunately, however you want to look at it, but if you decide to take that route, the results work.
Yeah.
Like
And
it's
I would
not.
say never wait for the doctors, nurses, or staff to get a hold of you. I I'm my best advocate, and nobody's going to fight more to keep me alive than me. And
Yeah.
so
Yeah,
And
I
then
remember
I,
when we got that call and we were supposed to get scheduled for like a referral to another hospital and like they'll call you in 5 to 10 days and I was like, no, I'm calling today. We're gonna go
yeah,
ahead and get that appointment. I mean, it's as basic as that. It's as small. I
yeah,
mean, that sounds small, right? But like, most people will just wait, and you don't have to wait. Period. You don't have to wait, and they will. They'll get to it at their own time. But you have the power to kind of make those
yeah.
decisions, and good for you. Is there anything I have failed to ask that you would like me to ask, or you would like to tell people listening to this?
Not that I can think of. I don't have a great memory without having like a fuse triggered to set it off.
That's what happens in your
Yeah,
50s.
yeah.
I can attest to
Also
that.
happens when I'm on a couple different opioids. And
Well,
but
what I will say is I've I've appreciated your time so much, and I will. I'm gonna, I don't know what kind of headway I'll make, but I'm gonna try to get in touch with Mr. Collins and all the other people, and I've gotten in touch with people that I shouldn't be able to get in touch with. So,
yeah, you just never know. So
yeah. Well, I will be in touch, and
okay.
I've got, as you can see, I've got another call coming in.
Nice to
Um,
meet
it was so nice to meet you. We'll be in touch, and
Okay.
we'll talk before all this goes out.
Okay.
All right.
All right. Talk to you later.
Thank
Bye.
you. Bye.